Before watching this video, click on the subscribe button. Bonjela is an antiseptic pain-relieving gel. It composes choline salicylate and Cetalkonium chloride. It also contains ethanol. The category is oral care and topical application to the oral mucosa. Uses or indications. The Bonjela is used for the relief of pain, discomfort, and inflammation caused by common mouth ulcers. Cold sores. Denture and sore spots. Mouth ulcers and sore spots due to orthodontic devices. Bonjela also fights minor mouth infection. Teething pain. How does Bonjela work? Choline salicylate belongs to a group of medicines called non-steroidal anti-inflammatory drugs. It's similar to, but not the same as aspirin. Choline salicylate reduces the inflammation and pain by reducing the production of the prostaglandins in the area of the mouth it's applied to. While Cetalkonium chloride is an antiseptic that kills a variety of bacteria and fungi that could infect sore or broken skin and mouth. It helps prevent irritated areas from getting infected, and this can help from heal. So now, how to use Bonjela? Wash your hands properly. Apply the enough Bonjela to cover the fingertip and rub gently into the affected area, not more often than every 3 hours. Who should not use Bonjela? Those people who are not allowed to use Bonjela are the people with an active stomach ulcer, people who are allergic to salicylate, for example aspirin or any other ingredient of the gel. It is also not suitable for the babies under the 4 months. Side effects. The side effects are depend upon person to person body mechanisms. It is not stated that every person will experience the same side effects. Allergic reactions such as asthma attacks in the susceptible people. Bonjela interactions and warnings. Bonjela may enhance the anti-blood clotting effect of the anticoagulant medicines such as warfarin. Preparations containing aspirin should not be given to infants during the Bonjela treatment. Consult to a doctor in case of pregnancy and nursing women.